We welcome you on this edition of Max Doc Talk. World Health Organization has taken an extraordinary step of declaring monkeypox a global emergency. More than 75 countries where this virus is not endemic have reported the outbreak of this infectious viral disease. With growing concerns about monkeypox, the internet is breaking out with questions related to this viral infection. In this session, we'll learn more about the outbreak of monkeypox, the common causes, symptoms, and the treatments associated with it. Joining me in this session is Dr. Sandeep Buddhiraja, Group Medical Director, Max Healthcare. Welcome, Doctor.
Thank you.
My first question to you would be about the causes and symptoms of monkeypox. How does one recognize the early symptoms of monkeypox?
So monkeypox is caused by monkeypox virus, which is a cousin of smallpox, which we all know was eradicated from the world in late 70s. The symptoms of monkeypox are milder as compared to those of smallpox. So typically a patient would start complaining of fever, which can be high grade, associated with chills and rigors, severe body aches, headache. And this is typically then followed by upper respiratory symptoms like sore throat, cough, runny nose. And then a very typical feature is the rash, which typically would start after these symptoms. The rash can affect any part of the body, but what we have seen in the present outbreak is it is mostly present on your hands, that's palms, soles, chest, face, inside of mouth can be affected, and your genital areas, and including perianal areas. This rash goes through a sequence of changes, and ultimately the lesions or the pustules, or what we call as they are acne-like spots, they start crusting and then they fall off or shed off, and then the normal skin returns. Another interesting feature of this disease is enlargement of the glands, which we call as lymph nodes, typically in the region of neck, which is not seen typically in many other viral illnesses, including smallpox. So this is how a typical patient of monkeypox would behave. And in a typical case, again, these symptoms last for up to 3 weeks. That's 21 days. A typical incubation period, and incubation period means how long does it take for a person to start getting symptoms after he or she has been infected, is about, again, anywhere from 1 to 3 weeks, but typically about 5 to 10 days. So it is very important nowadays, since we know that, as you rightly said, it spread to over 75 countries. Initially, it was seen in people who had recent history of travel from African subcontinent, because that is typically where this disease was so far found to be. But now we are seeing that people without even having any history of travel are reporting cases of monkeypox. So it's very important for people to understand the symptoms of the disease and to report it to their doctors immediately they come out with any of these symptoms which I have just explained.
Okay, Doctor, we all witnessed the multiplying effect of COVID-19. Can monkeypox spread like COVID-19? And who is at the highest risk of contracting this virus?
And that's a very important question, because we know that COVID-19 pandemic is nowhere near its end. And every time we feel that it's about to end, we see a new wave or a new outbreak happening. And what is the reason for that is because the COVID virus, as we know, keeps mutating, keeps changing. So it becomes more infectious even after you have taken vaccination. And the typical way by which COVID spreads is through airborne infection. So droplets and aerosols. Aerosols are much smaller particles which can float in air for a longer period of time. We also know that it spreads through close contacts and improperly washed hands. And hence the way to prevent COVID is by wearing mask, maintaining distance, and hand wash. Unlike COVID, because it is airborne, it is highly infectious. What we see in monkeypox is that it is a disease which is not as contagious or as infectious as COVID is, because the main route of transmission of monkeypox is through close and significantly prolonged physical contact. So if there's a person who's taking care of a person who's infected with monkeypox, there's a close physical proximity, close physical contact, or there is contact with the household objects like, towel sheets, pillow covers, utensils, they can transmit the infection. Similarly, close face-to-face contact, sexual contact is again a very important way of transmission. And in fact, a lot of cases of monkeypox which are being reported, especially from US and Europe, are seen in gays and MSMs, men who have sex with men. Those are the ones who are most at risk. But otherwise, it's not a disease which is gender specific. Through the mechanisms I have explained, it can spread in either gender. Another important thing to remember is that there is also another route of transmission, which is through the droplet infection. That means if a patient of monkeypox coughs and sneezes, and another person happens to be in a very close vicinity and contact, it can go through the droplet infections, but not aerosols or airborne as happens in COVID. Another route which is also reported is mother to child transmission. So if a pregnant woman or a mother gets it, she can transmit the monkeypox virus to the child, unborn child as yet. So these are the routes of transmissions. And that is the reason we always say in terms of precautions that you have to limit physical contact with the patient. Healthcare workers are also at increased risk of getting these infections because they might examine the patient. So it is important for the doctors and nurses also to take proper precautions when they are sort of examining these patients.
We talked about the early symptoms of monkeypox. In case someone suspects the early symptoms of monkeypox, do the patients require immediate hospitalization?
So now it is increasing the awareness. So people first should know what the symptoms of monkeypox are. And if you feel that you have any of these symptoms which could be suggestive of monkeypox, the first thing you should do is report it to a doctor, report yourself to a healthcare organization or institution or hospital or a clinic. Important thing is that when you decide to go to a doctor, please ensure that you are fully clothed. So you are wearing a full sleeve shirt, you are wearing trousers, and you have put on a mask, and do not use public transport. So do not travel in bus, do not travel in metro, use your own personal vehicle so that you avoid spreading the infection to others. And once you report to a hospital, please ensure that you report your symptoms at the first point of entry in the hospital so that you can be properly isolated and segregated. You will be asked to see a doctor in an isolated room, and the doctor obviously would also keep similar precautions in terms of doctor is properly protected. He would have worn a mask and gloves before he or she examines you. Most of the state governments have decided on certain hospitals which have been designated as nodal hospitals in case a person requires hospitalizations. So the disease is notifiable. The government agencies have to be informed about the disease, and then if a person requires hospitalization, he or she would be referred to a right hospital which has been designated for this purpose. But the good point is that not many people will require hospitalization. It is not a very severe or a serious form of disease. There are actually two strains of viruses which cause monkeypox. One is a Congo Basin strain, which is or a subtype. This particular strain or subtype is much more infectious and much more serious and has a mortality rate of 10%. The other strain is the West African strain, which has a lower mortality, less severe form, and overall reported mortality is about 1%. And if at all I would call, a good news is that the present outbreak which is there in the world is reported by the West African strain, which is the less severe form of the disease. But yes, it may not be, it may be less serious for most of the people, adults and healthy population, but it can form a serious disease for certain groups of individuals who need to be very careful. So people who are immunosuppressed, that means whose immunity is low either because of some disease they have or because of certain medications like steroids or cancer treatment drugs which they might be on, increases the risk of making their disease more severe. It is also reported that pregnant women and children, if they get this disease, could have a more severe form of the disease. Whether people who are suffering from HIV would have or are more likely to have severe disease or not is not yet known fully. I think it's only we have to wait for future for some better research and data to come in to suggest who all groups of populations may be at more risk to get a severe disease. Another very interesting point to note here is that we know that smallpox vaccine is a preventive step against monkeypox. We also know that smallpox vaccine was being given routinely to the global population in up to late 70s. In fact, US discontinued smallpox vaccination in about 1972, and in India we discontinued this vaccine in 1978-79, and that was where officially the world was reported to be free of smallpox. And people who were born before that would remember and would have noticed a scar on their body, which is a evidence of having received smallpox vaccination. Now, it is said that people who have been vaccinated for smallpox in past might not get a severe disease, and in fact they may be protected against monkeypox. Now, that may not be entirely correct, because it has been reported that even after having received smallpox vaccination in 70s, people have still got monkeypox, but generally the overall disease may be less severe in them. So that's actually a good news for the elderly population, because most of the elderlies living today would have had smallpox vaccination in their younger times, and they actually may be protected against the severe form of monkeypox. And this is very contrary to what we see in COVID. In COVID, actually, the elderly population was at most risk, which may not actually be the case in monkeypox. What all I have seen so far is actually what we know from the limited information since the start of this outbreak outside of Africa, which is just since early May. So as the time evolves and we get to see more cases and more data comes in, actual reality of how severe the strain is, what actual is the mortality, would actually start coming up in a much better and robust fashion.
Doctor, when we talk about the severity of monkeypox, do you think there is a vaccine to prevent monkeypox?
Yes, smallpox vaccine, as said, is known to offer protection against monkeypox because the two viruses come from the same family. On having said that, as I said that, people who have had smallpox vaccination in past, to some extent, they are protected. But many times we see that over decades, the immunity wanes off. So how much protection would still be offered by that vaccine which they took in their young age, 40, 50, 60 years back, is yet to be determined. But now what is being recommended is people who have had, presently I'm talking about, have had a close exposure to people with monkeypox. So let's say close contacts, family members, healthcare workers. Now, in US and Europe, they are being recommended smallpox vaccine. And smallpox vaccine given very early after exposure to a confirmed or a suspected case of monkeypox does offer protection against a person getting monkeypox. But the problem here is that this vaccine is not available in all countries across the world. There are only very limited countries in the world which have stockpile of smallpox vaccination where they are giving this vaccination now. I think this might be a repetition of story of COVID, where world might have to restart production of smallpox vaccine if we see the numbers start increasing significantly. And the good news is that technology and platform for creating this vaccine exists. So it would not take a very long time for the companies or vaccine manufacturers to manufacture a new batch of smallpox vaccine. But yes, in terms of protection, it clearly gives you protection, especially if given on time.
When we talk about awareness around monkeypox, what would your advice be to our listeners? And how can they stay safe during these times?
So again, the most important thing is creating awareness of what the symptoms of this disease are. I said the two most important discriminating or differentiating signs and symptoms are presence of a rash, a characteristic rash, and presence of swollen lymph nodes. Other than that, this disease behaves like any other viral illness. In fact, if we don't have rash and don't have lymph node enlargement, to differentiate it from flu or COVID or any other viral illness would actually become very difficult. But we see even in the present outbreak, majority of patients have had this characteristic skin rash. So important thing is creating awareness amongst public that the moment you report any of these symptoms, immediately get yourself seen by a healthcare professional. And as I'd already said, please isolate yourself immediately, take precautions, make sure that your personal utility items are kept separate and the other family members don't use it. It is also important for the caregivers and the family members to understand that it is a disease which is transmitted from person to person now by close contact. So you should avoid any close proximal contact or not be in close proximity with a patient who could be suspected of having monkeypox. And also, do not hide yourself from this disease. A lot of people have that sort of mindset that the moment you get an illness and you are told that it is a disease which is reportable or you have to isolate, you just don't talk about it. And the family members also sort of say that, don't go to the hospital, you'll be kept inside the hospital, you'll be isolated. That's a very wrong way, because then you are promoting the disease to spread more in the community, in the families. And that is something, the important point of monkeypox is it is still a controllable and preventable disease, provided all of us know the do's and don'ts. And these are very simple do's and don'ts. So please follow the instructions which we have just spoken about.
Thank you so much for joining us on this live session. If you have a question, feel free to drop it in our comments. We thank you for your time, Dr. Budhirajan.
Thank you.